and welcome to our next panel discussion on engineering in surgery and intervention. My name is Mike Mika, and I'm a professor of biomedical engineering here at Vanderbilt, and I'm the director of the Master of Engineering in Surgery and Intervention program here at Vanderbilt. For those that don't know about the program, it's a professional Master of Engineering program, and it emphasizes advanced technical skills at the cutting edge of surgery and interventional technologies. We provide aspects of professional development. We also have a capstone design process that we have that goes over the complete semester. And then we have our hallmark is really our clinical immersion work. And so you really get a good sense for where these technologies are deployed. And so, it's a great program if you get a chance to look at it. If you want to look it up, you can look it up at http://vu.edu/ESI. So with that background done, in our previous discussions last spring, we discussed a lot of areas where engineering is playing an interventional role within surgery and intervention. We looked at open software developments. We looked at robotics, careers in industry, and entrepreneurialism. We also looked at the entrepreneurial environment here at Vanderbilt. So today I'm super excited to introduce to you two Vanderbilt entrepreneurs that are really hitting this hard out there. So with that, we're gonna see kind of what they're working on today. So let me begin by introducing our panelists today. First, we're going to have Dr. Duke Herrell, professor of urology and director of the minimally invasive urological surgery robotics program here at Vanderbilt University Medical Center. He's also CEO and CMO at Virtuoso Surgical. And we have also with us Dr. Bob Webster. He is the Richard A. Schroeder Professor of Mechanical Engineering at Vanderbilt University. He's director of the Medical Engineering and Discovery Lab. He's also president and CTO of Virtuoso Surgical. So you can see the theme here for Virtuoso Surgical. For those that don't know Bob and Duke well, there's some bios that are going to be available online later if you wish to. So again, I appreciate you both for coming and speaking on behalf of the program and this interesting area that you're working in your company and whatnot. So it's going to be interesting to talk for the next 30 minutes or so. We'll shoot the breeze and then we'll be done with this. And you can go on about your day. I'm sure you're busy. So let me start first. I'll just jump right into it and start with Duke. You're running at about 200% effort right now in this program plus treating patients. So a lot of folks probably don't know a little bit about your clinical background. They probably don't really even know where robotics and urology kind of cross over. So maybe you can just tell us a little bit about your specialty, kind of what you work on, the kinds of things you treat, and then maybe a little bit about what robotics has done for you in your area.
Yeah. Well, thanks for having us on, Mike, and certainly it's a pleasure to be here. I'm a urologic surgeon, or a urologist as we're called. We're really the surgeons of the genitourinary tract, both for males and females. And so we address everything from surgical kidney disease like tumors and cancers in the kidney, reconstructive efforts, all the way down through the bladder and the external genitalia. Many of us subspecialize, certainly in the academic realm. It's a great specialty, but my concentration is mainly in caring for patients with prostate cancer and kidney cancer and doing robotic surgery. But I also do a fair bit of endoscopic surgery. So the other thing that urologists are known for is adopting technology. And so we do a lot of procedures with scopes and lasers within the urinary tract, things for stones and tumors that are lining the urinary tract. The background of robotics and urology is quite interesting. Many of our listeners may not know, but the current robot that's referred to the most, the Intuitive Da Vinci, actually emerged out of Stanford. It was not known as the Intuitive Da Vinci then. It was a prototype. It was licensed out to a company, Intuitive, and they were initially bringing it forward for cardiac surgery. They tried that and had met with minimal success. But along the way, they encountered urology, and it was about the time that there was a big push to do laparoscopic prostate cancer removal, and the robot made that a lot easier and simpler for people. I like to joke that I was amongst about 40 or 50 people in the world that could do a laparoscopic prostate or a laparoscopic partial nephrectomy, and then the robot evened the playing field. So good technology advances surgeons' abilities. And so urology has certainly played, I think, an unbelievable role in the advancement of Intuitive. They've gone on to be over a $100 billion company, are thought of as one of the most important medical device companies in the world at this point. And so there's a lot of history there. They've spread out into many other specialties at this point.
So I'm going flipping back to Bob here. So clearly you're embroiled in this entire field of robotics. So and you run a lab at Vanderbilt, and you're doing a lot of these cutting edge things, the medical engineering and discovery laboratory. Can you tell us a little bit about your laboratory, kind of the core technologies, and kind of what are the impacts you're seeing in the area as well?
Yeah. So actually, my lab is it's totally focused on solving problems for doctors. So we look at the whole process of medical intervention, surgery. We go in with a completely open mind. We don't want to bring a hammer and look for nails. We want to look for the nails and then design the perfect hammer to hit each one. So we go into the OR and we watch and we talk to the physicians. We ask them where they see the trouble spots in surgery being. And we'll bring any technology that we know of as engineers to bear to solve those problems. So that leads to what would look like on the outside a pretty eclectic set of technologies and things that we do. It's really today mostly centered around image guidance and dexterity. So those are two things we see that surgeons struggle with, is knowing where they are and where they want to go, because they see the tissue, they don't know what's beneath it until they start to pull things apart and cut into it. And we would like to give them that sort of X-ray vision with image guidance so they know where things are before they make the first cut. So that's the image guidance part. And then the dexterity comes about in surgical robotics. And we have a couple of different technologies that make surgical robots 10 times smaller than they are today on the market. And that's one of the things that Duke and I are commercializing through Virtuoso. So that helps surgeons deep in the body go through tiny little openings and then be able to move their tools around and have the dexterity they need to do complex procedures. So that, in a nutshell, that's my lab. It's about 10 grad students, mostly PhD students. We have one ESI student working in the lab right now, and it's a great team.
Yeah, that's great. Really exciting stuff. I mean, I'm amazed by a lot of the work that you're doing. It really does give almost like superhuman joints, to the surgeons. It allows them to do things that they really just can't do. And maybe that brings us a little bit to the next question. Maybe we'll start with Duke and this with. So you're obviously, your other hat that you're wearing is associated with Virtuoso, and it's going strong right now. So I guess, can you tell us a little bit about the technology associated with it, right? What's your kind of role right now in the company? And then I got to ask, the name, we got to know where the name comes from. Very good company, we got to know. So yeah, can you give us a chance to give us a sense of what the company's about?
Sure. Well, and certainly I'm sitting with the person that invented the base technology that we're taking advantage of. And so, me explaining it is always amusing, but basically we're using these nitinol concentric tube manipulators to scale down, in essence, small dexterous instruments where they've never been put before. And so the example I'll use at Virtuoso is we do within urology and actually many surgical specialties, rigid endoscopy. And we have a limited toolkit. Our tools are very archaic, for want of a better word. Single tool, no wrist, little dexterity. We're really operating as we did over the last 30 to 40 years. And so with concentric tube manipulators, which I'll let Bob explain if you want a more in-depth explanation, but we're able to scale down to 1 millimeter in size, give surgeons 2 hands at the end of a scope that is less than a centimeter. 8.3 millimeters is our standard outer diameter of our scope. We're able to bring 2 tools through this into a place where 2 tools have never been before, and then provide dexterous interaction such that we can do things like retract, cut very precisely, have the tools interact. We're actually working on complex surgical maneuvers at the tip of the scope. And at some level, this is kind of what Da Vinci did with laparoscopy, but they need a football-sized workspace. We need a golf ball-sized workspace. And I like to joke that we get there through a cigar-sized tube, which again makes us minimally invasive at a level that rigid endoscopy takes advantage of right now, but we can do even more. Yep.
If you were to estimate, like what fold of increase in capability is it giving you, like 2-fold, 10-fold? What do you think in terms of psychiatry?
I would say that I don't know that I even want to estimate that, because almost every single surgeon who drives this technology uses the phrase game changing. And I've been around long enough. I have enough gray hair as a surgeon to know that there are very few things that are game changers in what we do. Da Vinci did it. There's a few others out there that I think are coming along, and I think this is going to be one of those technologies. But of course, I'm biased. You asked what my roles are. Bob and I rolled this company out of Vanderbilt in 2016 and opened the doors in 2017, really because we figured out that modern day medical device industry doesn't do in-house R&D very much anymore. They look to startups and other things to de-risk technology along the way. And so we have been doing that over the past 6+ years. I initially served as CMO, and then more recently over the past year, I've stepped into the role of CEO and kept my role as CMO. So I like lots of hats. It's been a great experience. We're really nearing a point which, again, there's certain inflection points for devices when you finish prototyping and you're getting ready to go into verification and validation testing, which is what we're doing right now. The next big hurdle is first in human experiences, and then onward, hopefully, to regulatory approval with an IDE study planned for 2024.
Exciting. Yeah. Just back to Bob. I mean, Duke kind of led in with the robotic type of robot that you're working on. But I guess, I'd like to also know, like, how did that all begin for you? I mean, obviously you have the technology. Tell us a little bit about that. But how did it begin for you in terms of kind of recognizing that this could be, play a role? And then I guess, just to give a sense to the students out there that are thinking about, you're right in their wheelhouse in terms of engineers and things like that. What was your design process kind of like for it?
Yeah, so the origins of this go all the way back to when I was a graduate student. So I was started off working on a super cool project, steerable needles that are still being worked on in the field today, hundreds and hundreds of citations. It's made a real big impact in the field. But even back then in grad school, which is now 20 years ago, I could see that we were 20 plus years away, if everything went well with that technology, to getting to patients. And to me, that was too long to wait. So I was too impatient. So I didn't want to do the rest of my PhD on that topic. So I sat around scratching my head for a little bit, talking to doctors, observing surgeries, and thought, what could I build that would have the same kind of curvatures that these steerable needles do in tissue, but would work outside of tissue and would be like Da Vinci, but much, much smaller. So at the time, people were taking robots and putting them into the mouth, down the throat. And I thought, what's the next smaller thing? Well, let's go into the nose, maybe. And could we make robots that small? So it was really that push for me personally in grad school to find something that I was passionate enough about to do the rest of my PhD on, that led to, and then talking with doctors and watching them do surgeries, that led to the idea that we're now commercializing, which is, if you think about like a telescoping collection of tubes, like an old school TV antenna that you would pull out and extend, picture that, but now picture each one of those tubes as curved, and each one of those tubes is very flexible. So it's made out of nitinol, same metal that cardiac stents are made of, or if you've seen the glasses that you can actually bend the frames and they pop back, it's that metal. So we make the tubes out of that. And if you picture putting a curved tube inside of another curved tube, if you aim them in the same direction, they'll bend to the side. If you take the inside one and you twist it on the back end and aim it the other way and it's still inside, they'll straighten out. And so you can picture, if you grab them both on the back end and you slide them in and out and twist them, now you've got something that bends and elongates like a tentacle, but it's the size of a needle. It's a millimeter in diameter. So that was the key idea in grad school. And after I had that idea, I was like, yes, finishing the PhD, started my career at Vanderbilt. And the design process was me and PhD students and some master's students working in my lab, looking at this and saying, okay, how do we advance the science? We need to model that thing. We need to write computer code that makes it move around. And we were doing all of that stuff, but we still didn't know where in medicine it would have a big impact. And we found out sinus surgery is a pretty small market and it might not support a whole robot. And right around then is when I met Duke and we started talking, and Duke was looking around. He's like, this should have some really big impact on medicine. Let me help figure out how. And then he went away and came back. We met every week. And probably after a few months, he walked into the lab one day and he's like, we need to do HoLEP. We need to do this prostate surgery procedure that we're doing now, which I'd never heard of. I was like, what even is that, right? So there's no way I would have ever, as an engineer, come to that application on my own. But it was through Duke seeing what we were doing and finding the best thing for us to do in medicine that then set us on this path. And so then the design process was iterative. So we've built probably 10 different versions of the robot that we have today over the span of 15 years, making it better and better and better, more practical, sterilizable, usable in the OR. And that was done in collaboration with graduate students who every step of the way were building those prototypes.
That's
and
great.
I'll add, we, as we realized that really putting these together, we had a robot that had these and they were very far apart and we were using as like a micro laparoscopic robot. and sort of the idea of jamming them closer together. I remember asking Bob and the students, like, can we put these together and put them down a rigid scope? And they're like, well, yeah, of course we can. And Bob always says yes. And I was like, well, giving us two hands at the end of that scope is revolutionary. Here's a procedure that needs to get better. But then it was right after that was the realization that almost every rigid endoscopic procedure would benefit from better tools. And if you look at like the Da Vinci Intuitive, they started out, they got urology, but now they've marched into gynecology, thoracic, general surgery. Once you have a better tool, surgeons want to use it.
Yeah, that's great. Actually, you're leading right into another question I have, which is it's a little bit of more of a description, I guess. When you think about the Master of Engineering program that we have, one of the things we're trying to do is really focus on clinical immersion and its value. So I'm going to ask both of you this question, starting with Bob. As far as it's clearly impacted your designs. I was wondering if you could speak to more what the students gained or what you gained, the actual seeing procedures, actually getting involved in that way. How did it change your thinking? How did it influence your design process? Do you have give a little tactile sense for that?
Yeah, well, it's essential if you want to have an impact in the real world. So a lot of times, you'll go to conferences, meetings, and you'll see good presentations and you'll see okay presentations. And often what differentiates them is that clinical interaction that people have. So the people who have the clinical interaction and are in the ORs and are talking to the doctors, they design things that can actually be commercialized and ultimately used in patients. And you look at the other group and they're designing sort of Rube Goldberg, like as engineers, interesting contraption, cool science, but you can see that there's some fundamental limitation why it would never be used in the real world. And so that's the difference. I think if you want your research to have an impact on patients, on what doctors do and how doctors save lives, you got to be immersed.
Yeah, it sounds like that clinical workflow, witnessing it for yourself and understanding is so important. And that brings me back to Duke, actually, with respect to, no, okay, you're dealing with engineers. We're a bunch of geeks in general.
So are we. So are surgeons.
That's right. We speak the same language in a lot of ways. I guess, how does it change you've talked about it impacting other fields and you're seeing it quite frequently now. But I guess when you walk into the OR now, or your residents do, that know what you work on and stuff like, are the gears changing? Have gears changed in terms of the way you think now? Is there an aspect of how you address, just look at your everyday practice and just thinking completely different now because you're working with engineers?
Yeah, no, I'm again blessed in the fact that, I joke, people always ask me, how did I get into this? And I said, well, I'm just a better mousetrap person, in that I always dream of there being a better way to do what I'm doing today, a more efficient and more effective way, hopefully to help patients. And so, I'm not an engineer by background, but I found my way into this discussion. I pursued a really high-tech area of surgery. But then, the interactions have really kept that alive and growing and have been just a wonderful part of this. I get the opportunity to work with brilliant engineers at, Bob and all of his students and many other students across the university and across the medical center and trainees and all of that. And what I would say is I think there's a growing need and desire for that. So my observation, I used to joke around that surgeons of old sort of stayed in one way of doing things. It was there was dogma, this is the way I've always done it. You have to learn it my way. That's it. And the only way we advance is to get out of that. And so what I see happening is we're seeing a lot more surgeons gravitate to that as they see the changes within how we've practiced over the last 2 decades. And then also, I even say the influx of engineering background people into surgery and other disciplines. We're seeing a lot more people come through and enter those fields either after an undergraduate engineering degree or sometimes a graduate engineering degree. And so they're really, I like to say, extraordinarily multifunctional. We have a young person that joined our group who works with Bob and I, who did a fellowship with us and stayed on, who's got an engineering background, who's just killing it right now and doing great stuff. So that's where I see it. And then for me, it's just a great opportunity to sort of stay young and keep doing fun things with really interesting and fun people.
Yeah, it just seems like the injection of all this technology and stuff has been really a good way for surgeons to innovate. It makes the job fun, really.
Yep.
It just seems the way it's going. I guess looking back to Bob, kind of same question, but I guess I'm more interested in the students a little bit too, and some of the things that Duke said at the end there. Have you seen some kind of really interesting, realizations from the students where you're like, whoa, this is a great innovation, holy smokes, I guess, what have you seen in your experience with the students kind of getting involved in the OR and seeing things and really innovating things maybe that you didn't even realize?
Yeah, yeah. Well, I mean, the thing I love seeing is when the light clicks on as far as what they want to do in a career. So, I'll give you two examples. One is Rich Hendrick, who's now our Chief Operation Officer and Lead Engineer at Virtuoso. So, Rich came into grad school very focused. He knew he wanted to be in medical devices. He knew he wanted to design new ones, and he thought he was going to work at a big company. He came into grad school, started doing great. I mean, was just doing great research from day one. Never had thought about being an entrepreneur. Thought that was probably too risky. He probably wanted to go lead an R&D group in industry. And so in grad school, he took a class, which I now teach, which teams up engineers and business students and law students. So he took that class at my encouragement. And by working with those folks, he actually got the picture, hey, I can do this. I can be an entrepreneur. And this technology I'm working on is pretty cool and has the potential to make a really big impact. There are big markets here, big profits to be made. And I think I could do this. And so seeing him go from like the standard course of going and working in a big company to then saying, hey, I want to launch a company and be an entrepreneur, and how successful he's been is really satisfying to me. And the other quick one I'll give you is another student of mine, Jenna Gorlowicz, who is now a tenured associate professor at St. Louis University, and also leads innovation there. She's working in the dean's office as the head of innovation. So she came into grad school not having no idea what she wanted to do, certainly never thinking she wanted to be a professor. And she worked in Vice in lots of different, even before Vice existed, this was a few years ago, but in lots of different projects. So she kept moving around and she tried a bunch of different things and ultimately found what she really was passionate about, which was working with people. Educational stuff is what she wanted to do. She didn't know that when she came into grad school. And that set the stage for her to say, hey, a faculty career, if I want to work on educational projects and I like research, faculty career might be for me. And she's been fantastically successful. She has startup companies on the side. She's doing amazing things at St. Louis University. So seeing, it's not always one moment, but it's the progression of figuring out what you're passionate about and what your career should be about. And I just love working with students through that whole process and helping them explore those things.
Oh, that's fantastic. No, I think, and full disclaimer, one of my students took your course too, and she loved it too. So it was awesome. So I think those are great opportunities. They're all here at Vanderbilt, which is great. I'm going to switch gears a little bit and go to a little different area here. You're both in the entrepreneurial world, and you have a lot of things to offer, I guess, in terms of potential hurdles and what are the challenges that are out there. You've discussed a little bit right there, Bob, even the idea of moving from an academic road to the entrepreneurial road. I guess, are there any tips of the trade in terms of or hurdles that you see, or things that students should just kind of know ahead of time to be ready for, really?
Well, I'm going to jump in there and say that what I recommend to almost every student who says the word entrepreneur, who's an engineer, is that they work with Bob or take his class, and seriously, I mean, when I would say that when I started out in this, there was no background in this. There was no training ground. There weren't courses on how to develop medical devices and how to work your way through all this. And kudos to Bob. He has not only developed devices and done this work, as many people at Vanderbilt are doing, but he's also willing to share it with other people and teach them about how to approach it, which I think is just fantastic. And I think that's one of the bigger pushes I would say to anyone who's interested in doing this program at Vanderbilt is, the ecosystem at Vanderbilt around entrepreneurial development, especially medical device entrepreneurial development, I think is as robust as anywhere in the country. There's a few places that are widely regarded, and I think we're amongst those few places, if not hopefully in the lead. So.
Yeah, to me, the biggest hurdles for people is just that you need to be a generalist if you want to do entrepreneurship, or even if you want to run a lab. And everybody comes into grad school knowing one or two things and not knowing a whole bunch of others. If you want to do robotics, you got to know computer science. If you want to apply it to medicine, you got to know biomedical engineering. You got to know mechanical engineering if you want to build the robot. And then if you want to talk about entrepreneurship and commercialization, you got to know business, you got to know law. So nobody comes with the full package. Everybody asks me, like, what do I have to know to work in your lab? And the answer is nothing. You know some things already, and there's a million other things you got to learn. So that's the biggest thing, is just being open to learning across a huge number of disciplines. And then the biggest thing that I think that sets people apart is knowing how to choose the right problems to solve. And you get that from mentorship. All of the vice faculty are great at this. I mean, this is by no means exclusive to us. Mike is wonderful at it, all of us. Like you always, as an engineer or a researcher, you have 50 different problems you could solve. And how do you pick the one of those that is the home run? It's very hard. A lot of people don't do it. It requires instincts, requires experience. You gain that through mentorship, through having faculty who have done it before, who guide your thinking and tell you how they think about these problems and approach these problems. And that really, to me, is the thing that sets apart the people who achieve dramatically amazing things and the people who achieve okay things, right? It's choosing the right problems.
And I'll add in there that it's the same thing that makes great surgeons, is they have to find a mentor or mentors, and you have to learn your craft with them. And it is indeed a craft. And so I tell all surgeons, you can be an entrepreneur, but you better go practice for a while first, or you want to understand what the real problems are. So.
Yeah. So that's awesome. So that's great. So you've talked about the Vanderbilt entrepreneurial ecosystem. You all love it. You're doing great here. All that kind of stuff. I got to hit this last thing. Bob, you had a great recent new award from NIH called the REACH Award. It stands for Research Evaluation and Commercialization Hub. This is going to have huge impact at Vanderbilt, huge impact in the Middle South, really. So I was wondering, can you talk a little bit about it and kind of what's going to happen in the coming years about that and how it's going to impact the entire area, really, and national?
Yeah. It's a 4-state network. First of all, it's not just Vanderbilt or just Tennessee. It's also Mississippi, Kentucky, and Virginia. And this program is open to everybody who works at any university, including community colleges, HBCUs, at anywhere in those 4 states. And what it is it's a $12 million grant. It's $4 million from NIH, and then we have $8 million in matching funds from those universities, the state governments in those states that are all being contributed in order to start new companies. So what happens is every 6 months, we'll give out 20 grants of $50,000 to people who want to start university or are coming from a university and want to start a company. And that's seed funding that they can use to bridge this gap, because the biggest gap I've seen between companies failing is a PhD student graduates or a postdoc comes to the end of their training and they want to launch a company, but the idea of taking no salary for a year while you try to get this off the ground is daunting when you could go to industry and make over 100K. And so we need a way to bridge those people. And that's why we wrote this proposal, is to have that money so you can eat. I mean, it's not going to be a lavish lifestyle, but you can eat while you're building out the business model for your company. So every 6 months, we will be able to give out 20 grants of this size, the renewable up to 4 times. So a given company could get $200,000 in seed funding out of this hub. So super exciting way to be able to just generate a whole bunch of new companies and support people who otherwise might decide to take the safer, easier way and go to industry, and just give them a little bit of an on-ramp into being entrepreneurs.
Yeah, that's just going to have a huge impact to the area. I think everybody's excited about it. I think it's what a great opportunity. Kudos to you and your colleagues for going after it. That's wonderful. I think that brings us really to the end of our 30 minutes here. So I think we're going to wrap it up right now. So I'd like to thank you both for your time. I know you're both busy. You're both working 2 jobs right now, basically making this company come to realization. And I wish you great success in that. But I really appreciate you coming on today and telling us all about the things that you're doing, kind of the impact that you're having, the company that you generated, and then really the impact that you're having into the whole Middle South here, really in Nashville in particular, especially the device industry, which I'm very pro. So that's great. Lastly, as a disclaimer, I always give a final disclaimer. I'm no expert MC at this stuff. I'm just an engineering researcher trying to do things. So as I always tell my kids, I'll do better next time. But thanks everybody for coming. And thank you, Bob and Duke, for taking the time out to tell us about your kind of exciting venture. Thanks, everybody.
Pleasure. Thanks, Mike.
See you next time.
All right.
In October.